Good afternoon, ladies and gentlemen, and welcome to the third in the series of CPI webinars. Today, the focus is on disinfection chambers and tunnels, which in recent times have been much in the news as constituting yet another solution in our battle against COVID-19. My name is Surendra Balakrishnan, and I'm the editor of Climate Control Middle East magazine, brought out by CPI Industry, which reports on air quality, among other mission-critical topics related to air conditioning, ventilation, and refrigeration. I'm joined on this virtual stage by Chris Rajamani, who is Deputy General Manager at Al-Hoti Stanger Laboratories, which has facilities in the United Arab Emirates and in the Kingdom of Saudi Arabia. Chris is a chemistry graduate with 26 years of experience with Al-Hoti Stanger. Engineering teams and facility managers often seek his advice during disinfection of pipelines and potable water networks with regard to efficacy of disinfection methods, safety to the systems and humans, and also to adhere to local regulations. Chris is my co-chair, and we are very happy to moderate the proceedings on a subject that has excited people for its reported potential for minimizing the spread of the novel coronavirus, and at the same time has drawn caution over its effectiveness and also possible side effects to health through the exposure of certain dosing agents. And with that, I would like Chris to address you now and to share the various topics of discussion. Chris?
Good afternoon, everybody, and thank you very much for the introduction, Mr. Surendra. I want to actually leave you all with a thought right now. Necessity is the mother of invention. I think this whole program is revolving around an invention which is reinvented for the use of sanitation. The topics we are going to discuss today is the effectiveness of disinfection chambers across multiple sectors. Key performance indicators from Dubai municipality in approving these chambers. The effectiveness of these disinfection processes with regards to trials, etc. From the safety point of view, we are looking at the different types of disinfectants which are going to be used, both liquid and UV. From another safety point of view, we'll be looking at the harmful side effects to the skin and the mucous membranes. Many of us have questions about the effective dose and the ideal contact time. Finally, we'll be looking at additional features for the healthcare applications. I give the stage back.
Yeah, thank you. So we are very pleased to note that over 300 people registered to attend today's discussions, including from the government, which is excellent news. So obviously it goes to show the level of interest in this subject. We urge all of you to keep an open mind, to remain engaged in the discussions, and to post questions. We shall do our best to get the questions out to the panelists and the presenter, and to answers. Also, what we would like to remind you is that we're going to be having a dedicated audience Q&A session towards the end of this webinar. So there are plenty of opportunities for you to get answers to your questions.
Yeah, we welcome questions. The format for the questions is going to be your name, your email address, your contact number, and your company's name with your question. Pointed out to the relevant speaker you are addressing the question to. Secondly, because this is a webinar and we are limited with our resources, some of them are not in our control. So you may have some net disconnections, etc. So please be patient. A word to the presenters, please do not leave this conference post completion of your presentation, as we may have some questions from the audience you may need to attend to.
Chris and I have agreed that he would largely moderate the discussions, whereas I would be responsible for collecting the questions we receive in the background and presenting them to the panelists and the presenters. And with that, it is our pleasure to invite the panelists for the plenary discussion. They are Ms. Hanan Ahmed, Head of Engineering and Maintenance Services at Al Baraha Hospital. Ms. Hessa Jafar Hassan Al Javi, who is the Acting Manager, Registration and Permit Section, Health and Safety Department at Dubai Municipality. And Bjorn Osby, who's a Project Development Manager at Lulu Group International. That would be Lulu Hypermarkets. So a warm welcome to the panelists for the plenary discussion. And I'm going to ask Chris to lead with the questions now.
Engineer Hanan, good afternoon.
Good afternoon to you.
Thank you for being a part of our panel. First of all, let me thank you and your colleagues and the medical fraternity for the wonderful job you are doing on the front line. I think the results are very positive now, and the country is going back to its normal operations. To the audience, I would like to just introduce Engineer Hanan Ahmed. First of all, I'm surprised to see a lady as head of engineering. And this is the first time, so I'm in awe of that. She has completed her education with the University of Kuwait and later on with the University in Al Ain. She has 21 years of experience in the Engineering and Maintenance Services Department. She's working extensively in enhancing all the hospital systems, upgrading, replacing, and improving all aspects. And hence, she is here with us today. Engineer Hanan, I have some simple questions to you. What is the benefit of this disinfectant chamber to the common patients and the medical staff?
Yeah, actually, I want to share with you the information and the certain measure that we did when this epidemic COVID-19 came pop out. First, we have closed all the entrances and exit and limited to one door. So this is to ensure that all the stuff it's coming out and in from that door. And particularly that door, we fix the disinfection tunnel. And if you want to ask the benefit behind this, actually it have, as you know, it have a solution. They are using. They are using most of the tunnels. They are using sodium hypochlorite, chlorine solution, or hydrogen peroxide. Our tunnel is using sodium hypochlorite. And the benefit behind this, that to let the staff, all the workers, the doctor, nurses, any contractor, when they are coming in and out of the hospital, to let them feel it is, you know, psychologically, when they feel that they are disinfected from this material, they can go home safe. At least give them the feeling that they are safe. What matter COVID or number of patients that we have. The other things, even though, on the other hand, even though, if you will, as you know, this is a disinfectant material. It will disinfect the services, the lab coat, the gown, whatever. But on the other hand, if this staff, he is infected, still he will be infected and still he will transmit disease. But at least he will feel comfort when he is going home. Got my point?
Yeah. So it is positive. The treatment, etc., is positive. What I wanted to ask you is, from the cost point of view, you know, the water consumption, the chemicals consumption, or the energy, how much it is going to affect a hospital like yours?
First, you know, in the normal situation, when we are buying any equipment with a liquid consumption, usually in the normal situation, we are getting this machine free, and the company get the benefit from buying the reagent. This is what in the normal situation. But in the crisis now, I feel it is costly because we buy the machine and we have to use to buy the reagent. And the reagent, this is a hospital. On each and single one who will enter, it will be used. So I feel it is costly. And, when you will search, and most of the tunnels, they are closed channels that you have to use their own reagent. If you will go to a less cheaper chemicals, and we do that, but we found it caused a problem to the filters inside the tunnels. It closed the filters and it stopped working. And when the company came, the manufacturer, they told us you lose the warranty because you use other reagent and so and so. So it is costly. But in regards to water, because we are mixing it and diluting these chemicals 1 to 10, and we have to use tap water, it is not costly. Electricity also, it is using one phase plug, so it is not costly in terms of water and electricity, but it is costly when you are using those chemicals.
I think you will agree with me. We're just not looking at controlling COVID here. You're also talking of dust, not entering into your systems. We are also talking of other different bacteria which can cause flu, viruses, etc. So this is not only psychologically important, but also it helps for disinfecting patients and the doctors and the staff coming in and out of a hospital. What do you consider for a hotel, or how would you recommend this for a hotel or for a nursery or for a school? Would you recommend this for?
Of course, I recommend this. In this situation, you will use all the measures that it is, all the possibilities. Air disinfector, UV light, whatever, sanitizer, alcohol, mask, gloves, everything, just to try to decrease the numbers of infected. Of course, I will recommend that one.
Yeah. What about the safety, with regards to the electrical points, etc.? Because this is in the outside environment and the humidity is high. How does your facilities take care of the electrical connections and the general makeup of the envelope of the tunnel itself? Do you change it quite often? Things like that?
No, it is from electrical point of view, it is safe actually, because the plug isolated, and we took the plug from inside and the wire only outside in this environment. But actually there are other aspects. Hypochlorous, some of the staff have allergy. So it causes, irritation in the eyes, irritation in the skin, irritation on nasal. Some people, they got coughing behind this. There's other things that it causes because it is sodium hypochlorite. It is like diluted kind of chloride. So it gets, the doctors, they used to wear gowns with different colors. It causes fading of some of the colors. There is other health issue, but from electrical safety, it is safe.
Okay. So in other words, with regards to the chemical part of it and your exposure as a human being, the lesser dose, the better. So we need to work towards the actual dose, which is good enough to
you have to use the dose which kill the bacteria. On the other hand, it will not affect the staff health or anybody's.
Thank you, Engineer. And you've been very helpful.
I have two questions, in fact, from members of the audience. One has come from Dr. Yola McCoy, and a part of her question has already been answered, but I'm just going to read it out all the same. I think one aspect she's asking is about, I believe Dr. Yola is asking is, the full question is, what concentration of hypochlorite are you dosing? And are you concerned about exposure limits and corrosion of the units? I think we've answered the first two. So if you could just answer the aspect about corrosion. And I also have a question from Gary Hogben, who's asking what level of hypochlorite as ppm per chlorine is in use in the hospital unit.
The chlorine used in a hospital unit, not on the tunnel, you mean?
I'm just reading out the question as such. I believe perhaps in the context of the tunnel, yes. So it has to be in the context of the tunnel. So
Yeah.
what level of hypochlorite as ppm per chlorine is in use in the hospital unit? He's obviously referring to the tunnel.
Actually, in the tunnel, I don't know the actual concentration, but I know the final, that we have to reach 10% of out of the total concentration. We are mixing 1 to 10. If I will have, for example, 10 ml, I have to make it up to 100 with water. Yeah, the final concentration, it is 10%. But I feel that it is high because it causes a problem for some of the stuffs. So it is not being tested before, you know. Yani usually we are doing testing, commissioning on those systems before using it or before trying it. Usually we have to do trial and do bacterial count and do swabbing when we are using those systems. But now, because in a crisis, in a sudden, the ministry buy it and fix it. So we don't have time to measure the concentration in regards to health or in regards to other aspects.
And do you have any issues with corrosion? Because that was the other question.
No. It is most of them, it's hard plastic, glass, and acrylic sheet with aluminium, so it doesn't have corrosion.
It doesn't have. Thank you.
Yeah, I think I can jump in here. And it's usually 1 ppm of pre-chlorine final after you do the calculations, as Engineer Hanan said. What we need to realize here is, if you go back to the swimming pools which we use on a daily basis, you're looking at a concentration of around 1 to 2 ppm, which is put in by the regulatory authorities, and this is constant. So if you're using a tunnel and it is at 1 ppm, you're going to be exposed to about 50% of what you would be exposed to in a normal swimming pool in the United Arab Emirates. Regards corrosion, I think Mani would be able to explain to us in his presentation later on. Most of the material which is used obviously is going to be non-corrosive material, especially like Engineer Hanan said, plastic and glass. And, you have a lot of new age material now, which is being used for the manufacture of tunnels. Can we go to our next panelist? Let me introduce to the audience Dr. Hessa Jafar Hassan Al-Jawi. Welcome. First of all, let me thank you, Dr. Hessa. The DM, the regulatory authorities are the unsung heroes of the COVID-19 crisis. I think you all have been working in the background, in controlling things, and now we have seen a massive drop in cases and fatalities. And we have seen a number of testing centers and hospitals, makeshift hospitals springing all over the UAE. To the audience, I would like to introduce Dr. Hessa Jafar Hassan Al-Jawi. She is the acting manager at the registration and permits section at the Health and Safety Department. She is in charge of the registration of different categories of consumer products, like maybe the disinfection tunnels and the hand sanitizers come out in the market now. In addition to this, she manages the health and safety permits for the Emirate of Dubai. Most importantly, she has participated, or she represents Dubai in high-level federal and local government committees responsible for evaluation of consumer products, policies, regulations, and safety. I'm sure most of our audience have got some questions for you, Dr. Hessa. Let me begin with some questions which we have drafted from our side. Let's go back to regulations. Has Dubai municipality at present made it mandatory for hospitals, schools, and nurseries to have a disinfection tunnel at the exit and entrance of their buildings and properties, etc.?
Good afternoon, everyone. Do you hear my voice clearly?
Yes.
Okay, very good. First of all, I would like to thank the CPI Industry Group for organizing such a webinar. I'm representing Dubai municipality today, and I hope, inshallah, we will provide the industry sector with the great and guidance about the technical part and the safety part of the regard to the disinfection tunnels and chambers. Regarding your first questions, if you mean that we are advising the healthcare sectors or the school or academic or even all any buildings to use this channel or chambers, I will give you a brief of what was happening for the last maybe 2 months. Okay, we know that at the beginning, many people, many investors invested a lot in this field because it's a new, actually it's a new practice, not well studied, and not here only in Dubai, in UAE, but also overall, globally. Many people used it, many people installed it, imported, operated. So it have been used in many sectors. We are in Dubai municipality, as usual, we are checking international best practices and standards and regulations. So I'm sure that maybe many of the audience here, they received the WHO, World Health Organization, they issued a release about specifically about disinfecting individuals by many means. Maybe one of them is the chambers and tunnels, because there are lots other devices and tools. So the summary was that these all, it can be used, but they are not possible and not recommended to be used in all the circumstances and all the conditions. Why? Here the question mark is. Because if you can see that the positive things, it will not like outweigh the negative things in these using these chambers. For example, maybe also engineer Hanan highlighted the main safety concern that many people will be irritated or will have reporting many side effects by using these types of biocidal products. We called it biocides, okay? Disinfection solutions and all this. So the safety cannot be guaranteed. Individuals can differ from one to each other. So we can say that before we are approving these channels, we check the safety aspect, the safety criteria of the structure of the channel. Also, we check the ingredient part. Now we change our procedure, just to be very clear. Now we know that we can't stop all the chambers. Okay, suddenly it can be used. I can't tell you it's very, very hard. Otherwise, the Dubai municipality will stop it as well. Okay, but we issued a circular. It's called circular number 53. In the circular, we mentioned all the safety regarding the structure. Like you can say that it should cover the electrical part. It should be slippery. There should be a drain for the liquid, for example, to avoid slippery. Many structure, many criteria and requirements also indicated. Plus, we comment and we put a clear guidance about the product that is used in these channels. For example, the certain kinds of the chemicals or biocidal product should not be used, and it's not advised at all to be used in these channels. For example, hydrogen peroxide. It is very well known by the APA. It is listed there as an irritant chemical. So, for example, this one should not be used. Another one, some chlorine-based product can be used, but it depends. It depends on the type of the chlorine base, plus it depends on the concentration. For example, the most commonly used and maybe safest one is the sodium hypochlorous acid. The hypochlorous acid, yes, And maybe I can add, I don't know if everyone knows, because in Dubai municipality, we are the controlling authority and the regulatory body that we approving these biocidal products. So we are advising who is installing or operating these tunnels to check the approval. We are approving all this through our very well-known system called Dubai Montaji system. And during our approval or the assessment, we check many aspects. We check the safety, which is the scope of the product. The product can't be used. So we are advising the industry also. Some limits can be used in human skin. Some concentration can be used, but not all the concentrations. So we are also asking for many efficacy tests. Maybe they are claiming it is effective, but when you are testing the product, you find no, it's not effective, or the formula is not what they are claiming. So we check the whole product profile assessment. We have lots of assessment criteria that can guarantee that the product can be used safely by human to the intended purpose and to the as intended to be used.
Okay, my second question was about you explained that there are a number of companies coming up with this concept of and manufacturing disinfection chambers and tunnels, etc. How are you going to control those spurious products? Products which come which are not manufactured properly. Number one, and since this is more towards the human exposure, etc., would you be putting a sort of a mechanism to control the manufacture and distribution of these disinfection tunnels similar to pharma products, with a batch number or something trackable?
Yes, sure. We have a full system, and we have a full control mechanism from starting from the product registration. This is the first one, step one. During this product registration in Dubai municipality system, okay, it's called Montaji system. As I mentioned earlier, we check the whole product safety, whole product profile in regard to its safety. Okay, once it's approved, and we have another program called market surveillance program. We have inspection programs at the local market, plus at the, some of them are B2B, business to business, can't find on the local market, and not a retail product. So we have all the Dubai ports during shipment. I know we know that there is a local manufacturer, plus all the products that are imported are inspected, and even we withdraw sample for testing to make sure that they are compliant to our regulation and standards.
So, for example, if I want to purchase a disinfection tunnel or a chamber, and a supplier comes to me, do I look for approval certificate from him which says that, look, this has been approved by the DM with the stamp, etc.?
Yes, we issue a certification. It's called the product registration from Dubai municipality, from Health and Safety Department. Plus, in addition, we create like an open data tool that anyone can search. We know that some product that is B2B is not no barcode, but there is you can search in this open data tool by product name as well. We launch Montaji, same name. We launch Montaji mobile application. Okay, you have a link for the application, plus you have a link for the web. You can search by the web also.
Okay, thank you. Now, we also...
Could I just ask a few questions? These have come from members of the audience. Thank you, Dr. Hessa, for answering the questions so far. Now, one of the members of the audience, his name is Daniel Mack, and he says, where can we get a copy of Dubai municipality's guidelines on use of tunnels? And is it available in English? Can it be downloaded from the internet? And he also perhaps wants you to elaborate a bit on Circular 53 and the objective or objectives of Circular 53, if you could please state that, because I think some other questions that are just coming in. I have one more from AK, that's all it says, the initials, AK, for Ms. Hessa. How long does it take for a company to get registered online with Public Health and Safety Department for online registration of products? I think it's a very general question. This is not specific to tunnels. So Maybe you could just elaborate a bit on where people can go to receive information from your department, and also a little bit on Circular 53, if you would, please.
We didn't issue any guideline, but instead we issued an external circular. Okay, this is code number 53. It is posted in the main Dubai municipality website. It is there posted, and you can find it, and it's available both in Arabic and English.
Thank you.
Circular has all the information. And regarding the product registration, maybe we are the only regulatory body in the UAE that is approving. Okay, so we put all our efforts. So we are just to make our customer happy, and because we know there is a demand in launching and importing this product, so I can say that we can approve if the product profile is completed and nothing is missing. Within 3 working days, we can approve it. But this is not including the time where the product should be tested, because testing time is different. Once we have all the documents, the review, the assessment review, and the technical part can be done within 3 working days.
Thank you so much. I just have one more question that I'm going to bring about. If you can just give me a minute. Yes, this is coming from Chidambaram Telapan, and he says, how different is a tunnel equipment used in hospitals compared to schools, banks, malls, etc.? Do you make that differentiation when you give permission?
No, because first of all, we don't have we don't give permission.
Okay.
So we don't have a criteria for it. Okay, so we don't. This is not our kind of concern, or we don't check this. The most important we have, after these tunnels is operating, we have some inspection programs from our other sections in our department. They check the safety of how it's operating, the safety of the tunnel. But we don't go detail about, because this is a new idea, it's a very new practice, globally new practice. So nobody also put these all criteria for such these chambers. So we don't interfere with this.
Dr. Hessa, I'll leave you off with after this question. We've just been talking about liquid disinfectants here. Any manufacturer has approached you with regards to UV treatment, which is a non-wet technique?
Yes.
Yeah, okay. And have they been successful, and have they started operations within the UAE?
Yes, we know there are people are seeing some challenges and some negative points about some, are becoming wet and all this, etc. So they're thinking of other innovative solution, they thought. But unfortunately, some, like even the WHO also, okay, they talk about this. We call it contactless solution ideas. For example, UV light. Maybe also there is another a new thing coming now, but still not well studied. Ozone, by ozone gas. All these are not recommended because still, for example, the UV is harmful to the skin. Even even if it's used, it will be used in the medical sector with the absence of the human. Like you cannot like exposure human directly to the UV light. It is not safe at all and should not be used.
Okay, thank you very much. And you said they are tested, before you give your approval for these units, etc. So you do the test for the water, or for the electricity side, or for the radiation, things like that. Do you keep Petri plates and cultures all over the place and check if the system is efficient?
You mean that after installing the chamber, do you mean?
Or maybe pre-approval stage, how do you know that this chamber is effective?
We don't approve any chambers.
Okay.
We put this is the responsibility of the one who will be fixing, installing, and importing this chamber. We give a general guidance, okay, a safety measures to be followed to avoid the side effects that can be and can be done from the chamber as a structure, plus from the ingredients.
Okay, so let me bring this question in another way. does that mean that we need to approach you for an approval for each and every disinfection tunnel or chamber we install?
No need. Pre-approval, no need. No need for approval, no.
Okay, so you install it and then come to you for approval, is it?
Yes.
Okay.
No. Even no need to come to us for the tunnel.
Okay.
Does not require approval at any stage.
As long as
what
people
about the
comply
chemical
with,
dosing stage? So sorry. Yeah.
Sorry?
No, I was about to ask, what about the chemical dosing agent? Or let's just not use the word chemical, the dosing agent itself, that has to be approved, yes? Or did you answer that question already? Or if you can just repeat the answer.
Yes. The product should be, because this is part of the regulation, that any product used, okay, locally or imported under the category or a group of biocides, okay, it should be approved by our side. So what we are doing, we are advising, okay, I know many people are approaching us, okay, like what solution to be used like this, etc. We are, because you know, some of them that who is installing the tunnel is not, they don't know anything about the product. So we are advising them just buy from a supplier that they, first of all, they register the product and their products are approved by the municipality. Plus, you should check the technical part from the supplier because they are aware. You should check the profile. If it's safe to be used, what is the approval scope? Some of them can't be used on human, some of them, yes, it depends. Some of them only approved for surface disinfection.
Okay.
Thank you,
I
Dr.
have one
Hester.
more question. This is regarding external circular 35. Now, let's say that a manufacturer installs one of these disinfectant tunnels and also advises the end user on the recommended dosage agent.
Yes.
Now, what happens in instances where the end user uses some other agent? Then on whom is the liability? Is it the end user or the manufacturer? Because the manufacturer for his part or her part has clearly indicated that this is the particular chemical that is safe to use, but then the end user might end up using something else. So on whom is the burden of liability in that case, in case something happens from a health and safety point of view?
If something happened, who will be doing the wrong part? Like, for example, I am a supplier of the product, okay? And within the product profile, if it is safe to be used, the dilution rate is correct. This is what approved by Dubai municipality. But who is operating the tunnel, they change the concentration, so they are responsible. They will be violated, and yes, they will be fined.
The manufacturer or the end user? When you
The
say
end user, the end user.
the end user will be responsible. I see. Okay. Thank you.
Thank you, Dr. Hessa. Please stay back for the question and answer session. I'm sure you're going to be grilled by an audience. So be ready for that. I'd like to call onto the stage now Mr. Bjorn Osby. Mr. Bjorn, first of all,
Yes.
my wife, she shops at Lulu. So,
Thank you.
know, I'm a fan of yours.
She will be
Mr.
fine.
To the audience, I would like to thank you all for being with us. Mr. Bjorn, as the project development manager for 22 years with the Lulu Group, 40 years of solid industrial experience from Norway and the Middle East. He's actively working to improve existing technologies and practices in the cold chain, waste recycling, back of house routines, hygiene and sanitation. He's currently working on the technical details to convert organic waste to energy and fertilizers. And now with the existing pandemic, he's replanning. I'll repeat it. He's replanning the complete hygiene and sanitation routines for supermarkets and food outlets in general for the Lulu Group. Welcome, Mr. Bjorn. Let me start with this question. I mean, we've got, I think, a lot of knowledge from Dr. Hessa and Engineer Hanan from the you can say the government side. Now, as an end user, as the Lulu Group project development manager, what do you think is the cost implications for the group? I'm asking in general. I'm not asking with numbers, etc., but in general, you know.
I think the cost is not so important at the moment. First of all, we have to go through this situation. This is the first of all, and then we will see how we will design and how we will invest in the future. What is it we have to do in the future to cope with this situation? But new projects, we see no issue because it will be a part of the of the construction, whatever we do. So it will be an investment and part of the asset. What is the problem is the 165 stores that we have to fit out with not one unit. I have counted, we need 8 units approximately, because we have customer coming in from entrance A, B, and C. We have staff coming in from 2 locations, male and female separate. We have suppliers coming in from 2 locations. We have waste going in and out, not in, out, sorry, of course, and so many things. There are so many things we have to recount now. Air conditioning, HVAC design, air flows, extraction, there are so many things. Next time we have maybe an airborne situation, then so we have to rethink really from the beginning. Investment, cost, maybe into some millions. Yes.
Okay, from the as you're saying, from the engineering point of view and from the maintenance point of view, and for facility managers within Lulu, this is going to be a sort of a nightmare. In other words, you know, trying to put this thing in control, etc. Now, my question to you is, you're doing it for the customers, right? Have you tried this with any supermarket of yours recently, and what has the customer response been?
We have not installed the tunnel as yet because we have some concern. We have some great concern here. After I was invited to this seminar, I went out to buy one tunnel. And I asked the supplier to confirm to me if this is approved and if this is, you know, the right thing to sell for me to buy. And I was not convinced. The first thing I did was to, which we always have to do. First, we have to get the rules and regulations. So I got the Circular 53 from the Dubai municipality to read. And in this one, it is written clearly, fogging and fumigation and equipment are not allowed for individuals disinfection. So where is the difference between fogging and spraying? That is only the pressure of the whatever you put into that tunnel. So we have to make it very clear between the regulations and or the advice from municipality, whatever it is, and the actual. What is the fogging and what is the misting and what is the spraying?
You mean definitions? Yeah.
Yeah, we have to clarify.
Clear definitions. Yeah.
Yes.
Sorry, in fact, there is a question that we have received along what Bjorn has said, and I shall read it. It says in clause 2 of Circular 53, it is stated that fogging systems and equipment are not allowed for individuals' disinfection. This clause seems to be contradicting with the remaining portion of the circular, which details the materials and safe disinfectants meant for human usage, etc. Could Ms. Hessa please clarify this? Thank you. So if I could have Dr. Hessa answer this, please.
First of all, even the products that is used by fogging and fumigation, it's not under our scope of approval. So we don't use any products to be used by fogging and fumigation because this can have many safety concerns. Even worldwide organizations tell the same. So by fogging, no, fogging is very different than misting. The particle size of by the fogging or fumigation is very small. The people can inhale it. It can have many respiratory problems, infections, irritations. So it is affecting it has side effects. So we cannot take the risk, because also our products not created to be used by a working system.
So let's use the word spraying here. Is that the right terminology then?
Sorry, I can't.
Is the right terminology for the disinfection systems spraying? Like, you know.
Yes.
Yeah.
Yes, by spraying and misting.
Okay. So we go back to Mr. Bjorn again, and Mr. Bjorn, you still didn't answer my question. What do you think? Would your customers like this idea?
Our customer will like anything we can do to make it safe for them. And this is raising another concern. Once they have passed the tunnel at the entry point, they should not feel safe. They should feel that they have to follow the rules and regulations. So, for example, we are protecting our staff, we are protecting our customers, we are protecting as much as we can without, I mean, if we follow the rules and regulations that are given by the government with social distance and face mask and gloves and these things which is in place now, we are safe. And I'm afraid that when customers pass the tunnel positive, they think maybe they are negative, and then they come out in the other end. You never know. We have 1.5 million, 2 million customers every day. So that is a false safety, and the tunnel must be a part of a bigger perspective. You cannot just lean on the tunnel to solve this problem. You mentioned, you asked me about the cost. I'm sorry to go back on that.
Yeah.
It's an enormous cost not to invest in the tunnel, but each dose of disinfectant will cost somewhere between 25 pills and 30 pills. And when you have 1.5 million, we are talking huge amounts every day. So we are talking 500,000 dirham per day if we have 1.5 million customers. Okay.
So I think maybe if you take my argument on this, it could be useful for hospitals and schools, for example, because they are more sensitive, and for supermarkets, maybe not. Depends on how you and your management, your health and hygiene decide and go ahead with it.
If this was a law, we have to follow. If this is a part of a beginning of a discussion, that the end of it, the discussion would be, what are we doing to protect our customer and our staff? We have to take whatever cost it is. But if this is at this point of time, I don't see that this itself will solve much problem if we follow the rules and regulations set by the government. You can see the situation is getting better day by day because people are following the rules.
Exactly, yes.
Right?
I agree with you 100%.
And we have to live with this for years to come.
Yeah. So going back to the engineering side of it, for example, once you install the disinfection tunnel, you'd be looking at a whole new engineering regime in terms of maintaining the disinfection tunnel. You know, their spray heads, they'll have scaling and deposition. They might have biofilms in them. So you might need to look at putting a more stringent, disinfection practice for the output points within the disinfection tunnels. Do you agree with me, and are you planning something in that line?
I see the tunnel at this moment as a temporary solution. I see it as something that should have been maybe placed immediately. In the long run, I will not be able to speculate on that now because we have to see, because we have to take so many things into consideration. I don't know if I could ask a question. I am confused about what is the difference between fogging, misting, and spray. The difference, to my opinion, as I have learned, is basically the pressure of the liquid, that the pump that pumps these things. And I can tell you that a spray is between 4 to 9 bars, misting is between 11 to 29 bars, fogging is between 30 to 70 bars. And the chemical that you or the disinfectant that you are sending through this is the same. So whatever is the irritation on skin and eyes in fogging, you will also get in spray. So I think the important thing here is what type of liquid and disinfectant is in the liquid that you spray, and the time it takes to actually work.
You use a lot of food grade chemicals within your processes in Bulu for disinfection already for vegetables and surfaces, etc.
Yes.
Yes.
Yeah.
What do you think would be you would advise to be used in a disinfection chamber such as this? What would you recommend with your experience?
I will go about 2 years back in time. We, as you mentioned in the beginning here, that I'm working on waste management, organic conversions, and things like that, and that means bacteria control. We have to be very careful with our waste management, transportation of waste, and things like that. So we worked out to use hypochlorous acid because, or you can say that we are using it partially at the moment on a test, because we can spray vegetables, we can sanitize drainage. It's a food grade, as we heard earlier. So this is what I think we will end up using. Hypochlorous acid is alkaline water mostly, which is very efficient and which is produced by our white blood cells in our body already. So it is not harmless.
Yeah, and it's cost effective also as compared to the other chemicals. Yes,
yes.
It's not as expensive as these new age biocides which are there in the market. Am I right?
Yes, but I will not say do this or do that, because I'm not qualified to make a decision. So I think governments should, because I am a little surprised here because I'm referring to this 53 circular. Very clearly, it is written in the second page that alcohol-based products of all types are not allowed, or any chemical that may cause irritant or allergic reactions to skin and eyes, for example, sodium hypochlorite and hydrogen peroxide. So if this is written, stated very clearly here, that means you should not use. And
there's a question from the audience beyond just maybe it ties in with what you say, or maybe it does not, but I'm just going to read it all the same. This is coming from Leo Schuler, and he says disinfection tunnels seem cumbersome, expensive, and mostly of low benefit. Why not treat the air supply with activated oxygen, the world's most effective oxidizer and disinfectant? Would you like to comment on that?
Whatever Leo is saying, he is more qualified than me. So I would rather let him later on comment to that point. I am an end user. Mr. Leo Schuler is a specialist, so as far as I can tell you. So the problem here is that I am responsible. I will be held responsible if something goes wrong. And we have to do the right things. That's why my motto is do the right thing. Never, ever compromise on somebody want to save money, so they dilute things and it is not working, or they are using chemicals that are not advised to use. And then we end up with legal issues later. So we want to do everything as correct as possible. So that I can say.
We have some pre-event questions from the audience I would like to address. One is from Mr. Samiullah Khan, IBV GM. I can address this to Engineer Hanan. Engineer Hanan, is the chemical used child safe, food grade? What is its long-term impact on fabric cloth? Since you are using this continuously, generalized in general, I mean, you're using the doctor's aprons, etc. So Mr. Samiullah would like to know what is its effect. The chemicals, for example, if you're using sodium hypochlorite.
We are using sodium. Yes, we are using sodium hypochlorite. As I said, it have effect on some people, and actually we are not allowing children nowadays to enter the hospital totally. We close all the entrances, only the adult and the staff, no visitors, only staff and our contractor. So as I said, some of them get allergy and nasal irritation, eye irritation from this sodium hypochlorite with this concentration. And not I don't know, it depends on the fabric. Some of the doctors, they are complaining that they have fading colors. It get white, or less color concentration become less when they are entering. I don't know, maybe they are exposing themselves more, because the other, they did not get any fading, but some of them, they said no, it give fading to our colors.
Thank you very much. Now, we just have another 5 minutes to go, Mr. Surender. Am I right on this panel?
Yeah, we have about 8 minutes left. Yes.
Okay. So you want to bring on another question?
Yes, I mean, I have one more question from the audience, and the person hasn't identified himself or herself. But the question is, they are claiming that superoxidized water plus hypochlorous acid disinfection is the best and safer solution. Some companies have demonstrated the safety of their HOCl solution by drinking it from a glass with ice. Is this true? Does Dubai municipality agree with such statements?
No.
Perhaps, yes, Dr. Hessa?
Sure, it's not, it should not be drink. It is not intended to be ingested. This is at the end, yeah, we cannot say it's safe, for sure not.
Okay, there's one more question from Mr. Jeffrey Gardner, who's the Director of Engineering and Facilities at Marriott International. Chemical providers state that the virus and biocide agent used must be diluted to prevent negative consequences for humans and becomes too weak to affect the virus. How do you overcome that? Can you just shed some light on that? Maybe I can come in the end and assist you with replying to this one.
I don't know if I understand the question, but if you mean the efficacy of the product against the viruses and bacteria, for sure, once we are approving during the assessment stage, once we are approving the products, we check all these claims. We ask for efficacy test, okay, from accredited laboratory with accreditation scope of the test as well. So if the product, for example, claiming it will kill 99.9, we will not approve unless we have an accredited lab that can approve this or prove this.
Thank you, Dr. Hessa. Jeffrey, again, I think Dr. Hessa has answered 50% of your question, and 50% I'll answer for you. This could be a biased answer because I'm from a laboratory. Chemical providers state that the virus biocide agent used must be diluted to prevent negative consequences for humans. Yes. and becomes too weak to affect the virus. Yes. How do you overcome that? Jeffrey, once you buy a stock of chemical, it's always important that you not only store it in a, in a controlled environment. For example, you need some chemicals you need to keep within 25 degrees centigrade. Secondly, if you're going to keep it for a long time, you need to check the concentration or test the concentration from time to time. After you do the mix, for example, with water, etc., again, you need to test it. Similar to, again, the swimming pools, we add chlorine in it, and then we see if it is reaching the 1 to 2 ppm, the testing. I hope that answers your question. Yeah. Mr. Surendra, you have another question for the panel?
I think, no, I don't think so. No, not at this point. But some of them are questions that are coming that are not necessarily relevant to this discussion. Maybe I'll reserve them for the Q&A session at the end because they're more general.
Okay, so
could I add one thing to this?
Yes, please. Now? Yes, please. Yeah.
Of course, there is a question of what is the chemical, what is the dilution that you need to do, who control that dilution if you are not knowing what you are diluting and not knowing much about it. What is the time it takes? Obviously has something to do with the time you pass the tunnel, has something to do with the effectiveness of the disinfectant. And so I went to this shopping mall in Abu Dhabi that has one. And my wife walked in first and I walked in after her. And I could see with my eyes that the droplets was, to my opinion, too large. And upper body was wet and lower part was lower part was wet and the upper part was almost dry when we come out of it. So there has to be a certain pressure which is on the edge of fogging. Definitely not spray, because spray has big droplets. Otherwise, because when you put more pressure on that spray, you call it fogging up to the point. I mean, there are two extremes left. So there are many things we have to find out and not leave it to the end user to decide what to do on this matter.
Thank you. Engineer Hanan, you want to say something on this one before we close off? Okay. I would like to, in closing, would like to thank Dr. Hessa, Engineer Hanan, and Mr. Bjorn for coming in and sharing their knowledge with us. I hope it's been useful for us. Engineer Hanan, you're still here with us? Okay. Anyway, now I think we go on to the next section. Session. This is from the company called Eurostar. I think they are into manufacture of disinfection tunnels and chambers. A short introduction about Eurostar. It's a company which is into corporate business solutions, personal care products, and commodities training. Today we have with us Mr. Mani Nair, who is the head of marketing and business development for Eurostar Group. He's been with Eurostar since 1995 in various roles. The group has entrusted in engaging the anti-epidemic business solutions with prime responsibilities in personal care, in addition to the group marketing initiative. So let me welcome Mr. Mani on board. Before that, I just need to tell you, Mr. Mani, I was just going through your website and your disinfection tunnels are A1. I mean, it's just like getting into an Emirates aircraft.
Thank you so much.
The floor is yours.
Yeah. Hello.
Yes, we can hear you.
First of all, thank you, CPI, for arranging such a wonderful, seminar or a webinar. Yes, to be rightly put. And this is actually very much essential in today's world order, because we're going through this whole pandemic, and then we're trying to act responsibly in terms of how do we react to such situations. So I would quickly take you through the presentation, what I've been put in. So give me a minute. I would, Alka, can I share the screen? Hello? Yeah, hello?
Yes, she's responding now.
Okay.
Yes, you may, Mani, you may
Okay.
proceed.
Okay. So, yeah. So first of all, as I mentioned, we are all responsible. I mean, as a marketeer, this statement is very, very close to me. And I mean, I'll have to laud the UAE government and the Dubai government basically to spread across this message to all of us. And that's been the mantra. I mean, we could interpret it, we could talk about this in different contexts. But yes, end of the day, we are all responsible for our actions. So taking cue on that, and then obviously trying to keep things in very simple fashion. Prevention is better than cure. So in Eurostar Group, we thought let's provide a simple solution with simplistic approach, and that is how we have come up with this anti-epidemic products and systems and solutions, which I would probably take you through. I mean, I think when we had an expert panelist. I mean, I would really happy to share the knowledge and probably also learn from all the expert panelists in this webinar. But just to give a common understanding of various disinfectant methods which are used, which are very common, like bleaching agents, chlorination, water, swimming pool sterilization, floor cleaners, vegetable washes, dishwasher solutions, alcohol-based sanitization, and on the healthcare segment. Now, how safe is this disinfectant? I mean, that's where we would want to probably touch upon today. So based on the government regulations and based on the right prescribed usage of this disinfectant solution, one has to feel comfortable, or one has to feel good that yes, you're completed one stage of being safer. So we use in our tunnels food grade disinfectant solutions from a third party supplier, which is based in Dubai. I would probably talk about it in the next slide. So going back with that example, I think Chris had mentioned in the past during our starting of the session on an example of a swimming pool. So yes, we all in our lifetime we would have spent time in the pool. We all probably spend 30 to 45 minutes in a chlorinated pool, or probably where the water is chlorinated, and probably after the process we do swim. So the kind of product what has been used in our disinfection tunnel is another superoxidized solution, wherein the ratio is 1:3. That is how we recommend, or the manufacturer is recommending. So if you look at the technical parameters, would be, it's an electrolyzed water, 99.6% electrolyzed water with high sodium hypochlorite less than 0.02%, and the sodium chloride is less than 0.3%. So this basically gives one a confidence that we are using the right product, which is a food grade disinfectant solution and safer to use. Obviously, I think as Dr. Hessa had mentioned, this product, this disinfectant solution is approved by Dubai municipality, and I mean, the product brochure has been put. I would be able to, I'll be happy to share it with whoever would want as we proceed. So coming back to the Eurostar sanitization tunnel, we have got, I mean, thanks Chris for giving me the compliment of Emirates cabin. Well, yeah, that's the kind of standard wherein we have we have put across because Eurostar has been in this business, or probably in the technology business for the last 3 to 4 decades. Quality and after-sales service has been our hallmark of success. So keeping in mind the Eurostar's vision, we had brought in 2 variants. One is a mild steel variant with ACP powder coated, and the other one is a food grade SS304, predominantly used in kitchens and also in the F&B segment. The flexibility of using the disinfectant solution is left to the client. I would really, I'm really glad and honored by Dr. Essa saying it's the responsibility of the client to basically use the right product and in the right combination and in the right dilution method. So yes, so we'll all have to be responsibly acting. The product is comprising of effective sensors, motion sensors. We also have a nickel and brass nozzle with 14 to 16 nozzles. Depends on the client's requirement. A 0.5 HP motor. That's the structure, and it's a non-corrosive structure. There are in the market some inferior products which could be probably by wood or the other materials, but we would definitely recommend MS steel or a stainless steel product. Now, the application scenarios can be various scenarios, as we all know. It could be an airport, hotel, shopping mall, parks. We have already installed in a school, in a hospital, and very soon in a supermarket. A quick glance on the FAQs. I wouldn't take much of time, but then yes, it's a cost-effective solution when it comes to sanitizing a larger workforce or public space or movement. The tank capacity in our tunnel is a 120-liter tank capacity, but we can customize it. We could go to 500 liters or 1,000 liters, depends on the customer's requirement. We just did a 300 liter. As per the manufacturer's prescription, the dilution level is 1:3. So let's say a 30 liter of disinfectant solution, you need to add 90 liters of water. So that is how it is. And we have achieved by at least 2,500 entries. So I think I'd like to touch upon John Osterby's remark on what is the OPEX or operating cost. So it's less than 10 fills when you use a Eurostar tunnel in combination with the NADIS 2.0 superoxidized water, disinfectant solution. An AMC is available. We provide a 1-year warranty for the products. So basically there are consumable products like the nozzles, the motor, and the sensor, which typically becomes on a replaceable warranty plan. In addition to that, we also kind of equip this tunnel with the thermal scanner and a sanitizer dispenser. It all depends on the client's requirement. Proudly manufactured in Dubai, so that's something which we would want to propagate. And as I said, Eurostar doesn't prescribe, okay, the particular tunnel liquid, the disinfection liquid has to be bought from Eurostar. We have recommended NADIS because we've been using this for the last 2 months. We have installed many installations, and the product has been very successful, and we haven't faced any problems so far. So that's pretty much is on the FAQs summing up. And I just came across this article today, Sharjah government initiatives, they've installed 13 sanitization tunnels. So I guess, yes, if there can be some kind of regulation, or if there can be some kind of motivation, I wouldn't say a regulation, a motivation from the government authorities, wherein, to say prevention is better than cure. So let's if that can be a motivational factor from the government authorities, it would be a blessing in disguise for all the people. With that, I end my presentation. So again, we are all responsible, and that's what Eurostar is offering you today. Thank you, Chris, and thank you, Surinder.
Thank you, Mani. It was a very informative session. Before I can let you go, I have some questions for you.
Sure.
Number one is, have you got any successful installations which our audience can, visit and see? And what challenges did you face with the installation? Because you talked about, add-ons like thermal scanners, stuff like
Yeah. Yeah. So as of now, I would like to name Galadari Driving School because I've taken their permission to talk about them in this webinar. So we have installed it in the Galadari Driving School in Al Quoz, which is the VIP driving school section in Al Quoz. We have installed there a MS Steel, a mild steel fabric unit. It's been very, it's almost a month now, which is put into use. They're happy because whatever we prescribed, we told them 2,500 or 2,000 entries can happen with a 120 liter capacity. But what I got to know, they've crossed more than 3,000. So that's a winning point from a customer, because end of the day, his OpEx is less. He doesn't spend the way he was planning. The second thing, we also recommended a thermal scanner. So that's also that gives his customers or his guests, when they disinfect or when they get sanitized through the tunnel, they enter the premises, they have this thermal scanner giving a fever reading and a mask. So if you're wearing a mask, not wearing a mask, and this also can be doubled up to a attendance and access control system, because today we'll see most of the offices are having fingerprint scanner, or fingerprint entry scanners or entry systems, and so this can be eliminated. So this unit can be a 3-in-1 unit, where that's how we are moving towards. So we are scaling up into that level, because being a technology company, we're able to bring in solutions to the public.
I think that should be the motive behind the whole process, like Dr. Hassan, Engineer Hanan, and Mr. Beyond said. It's something in the making now. So as we go along, we need to keep modifying it to meet the different requirements, service the market. End of the day, it's going to be something which is going to be used in tandem with face mask, sterilization, social distancing, etc. So again, I want to thank you, Mani, for coming on board and giving us shedding some light on this subject. Next up is Mr. Surinder himself, and I have the pleasure of introducing him. Mr. Surinder is the co-founder and editorial director of CPI Industry. He fulfills the role of editor of Climate Control Middle East, which focuses on the HVACR industry from energy efficiency and indoor air quality perspective, among others. He has a bachelor's degree in statistics from the University of Madras in India and a master's degree in journalism from the University of Kansas in the United States. And he also helps my son with his spelling bee. So, Mr. Surinder, I think you can take the stage now and start with your questions. Yes, and maybe I'll come up with a couple of them at a later stage. Thank you for the panel for being on board till now. Thank you very much. So, Mr. Surinder will send you across some questions. Yeah.
Definitely. Thank you so much, Chris, for leading the questions at this up to this point. As I said at the beginning of this webinar, the purpose of this webinar is to arrive at outcomes, and hopefully we get more clarity. And of course, I thank Dr. Hessa and Ms. Hanan and Beyond and Mani for offering so much by in terms of clarity. Now, of course, we have more questions that are coming in from members of the audience, and we would like to obviously ask those questions. But before I do so, Mani, thank you again for a very interesting presentation. What is a typical dosage time for a very effective disinfection process?
Yeah. So, Surinder, with our experience and plus the installations where we have completed in the last 45 days, it all depends on customer premises. So, let's say in the Galadari driving school, we had kept a 7 to 8 seconds as a speed, in terms of the spraying. As we progress, or probably the feedbacks from their clients, they felt that it was completely, I mean, it's like giving them a shower. So then we had to bring it down to a 5-second, speed. So in terms of the spraying speed. So that is how I would say. So ideally between 5 to 7 seconds from close to 10 nozzles. We installed 10 nozzles. So yes, so that's been the level of the performance.
Okay, thank you. I'm going to read out a question, and this is, I believe, addressed to Dr. Hessa. And the the member of the audience has chosen to be anonymous. And he asks, does Dubai municipality have its own list of safe chemicals and solutions that can be used in the disinfection chambers and tunnels? And he goes on to add that if that were to be the case, then it would be far easier, because then instead of receiving and reviewing and approving different chemicals that land on your desk, you would have a set number of safe chemicals or safe dosage agents that is there as listed, and for people to choose and use for these tunnels or whatever purpose. Dr. Hessa?
Actually, no, we didn't issue any list, and we don't have a list now. And we don't recommend also to produce a list, because, we have like every day, maybe a range is registered in our system. So we will keep updating. It's not a practical way of issuing the list. So what we said, we are advising who's installing or buying these chemicals just to check the approval and the scope of approval. And our door are open. Many people approach us, consult us. We can give our technical feedback, guidance. Yes.
I see. Okay, thank you. There's one more question that's come this time from Sandeep Shetty, who says, why do we need to use the curtains as I've seen in some tunnels? Is it mandatory to use the curtains? What purpose do they serve? Maybe money or money, would you like to take that question?
Yeah, sure. So we have used the curtains in the installations where we have done in the driving school, but apparently in a different environment where the premises is not open to public. So I wouldn't be able to tell that there when the Dubai municipality or probably the authority approving the facility for open to public had visited, and they had made just 2 comments. One was to remove the plastic curtains, and they said that if you could, I mean, we kept a 7 speed pressure in terms of the nozzle, the spraying. So they said reduce it down to 5 seconds. So these were the 2 comments where we received from the Dubai municipality authorities when they visited a facility during the inspection.
I'm also curious to know, is there any guideline coming from the government that says that certain people would be far better off not walking through these tunnels in terms of pre-existing conditions? Maybe they're asthmatic or suffering from any other respiratory disorder. So is Dubai municipality looking at that at all, or is it a blanket rule that you have that the end users need to be responsible? But again, we're not just talking about end users as in the building owners, but the everyday consumers who are walking through these tunnels. So do you have any such clauses or sub-clauses saying that in the interest of public safety for asthmatic conditions and so on, Dr. Hessa?
We didn't release anything very clear about this, but for sure it's something like a logic that the end user, they should not, for example, force people to go throughout and work throughout the tunnel. First of all, this one should be optional, because as you said, some people are having some medical conditions, so they are more aware that should not be the responsibility should be done by them. It should be, they should be responsible for this. But from our side, what we state on the circular, that even normal people, you know, side effects can be done, can be happen even to normal people. So we are advising people like to have some trials at the beginning of installing this chamber, just to make sure it has no side effects, to just, yeah, as a precautionary measure.
I see. Thank you. And this question is coming from Gary Hogben at Feedwater Limited. And he says, what standards for virucidal efficacy are considered relevant in the United Arab Emirates? Would you again like to take that question? And maybe Chris, could you just add on to that also?
Thank you. Gary, Chris with you. I think you've heard of something called the Riddle-Walker's coefficient. You know, when you submit a sample to us for testing, like anything which has a disinfectant efficacy connected to that, what we do is we plate different types of cultures in different series and see at which dilution it works. If you had listened to what engineer Hessa said earlier, they accept accredited testing. Now, as a laboratory, Al-Houthi can do this test, but we are not accredited. We have only, at the moment in Dubai, we have the Dubai municipality who is doing it. We are working towards accreditation. The test method is in place. We have all the cultures, etc. It's just that, you know, as usual, Dubai municipality is being as tough with us as they are with the products, you know. So, yes, we have the test method, and we would go with different types of cultures if this is what answers your question.
I have one more question. This is coming from Chris Smith, and he asks, does atomizing the sanitizer disinfectant still have the desired effect? That is, it kills 99.99% as if it were still in liquid form. Who would like to take this question? Maybe Mani?
I need to add another question here for Mani, if you don't mind, Mr. Surinder. This is from Christian Pierce, if I'm pronouncing it right, SEMS Limited owner. He's asking how fine is the mist that is being proposed in microns. So I think it's more or less the same question. So if Mani can, you know, answer this question.
Yeah, hi Chris and Surinder. I think I'll have to apologize because of my the knowledge in terms of the chemistry. I'm not a chemistry graduate, but definitely I would love to probably come back with that answer to the CPI team once the session is over. Pardon me on that.
Okay, I'll just add something here for the initial question, but I wouldn't be able to answer on the microns part of it. It goes back to what I said earlier to Gary's request about the virucidal effects of disinfectants. What we do as a laboratory is we take positive cultures and place them within the disinfection chamber in a running condition. So we place them at, like, say, for example, top, mid, and bottom, and we check the rate of kill on this bacteria. So if you want your disinfection tunnel tested, like maybe before you start the operations, or maybe like after every quarter, you want to still check and see if it is good enough with the sprays, etc. Testing is recommended. Yeah, end of the day. Okay.
I have an administrative question for Dr. Hessa. How long does it take for a company to get registered online with Public Health and Safety Department for online registration of products? I'm assuming it's in the context of disinfectants and so on and so forth. And how do we follow up if you don't get reply on online registration? So it's a pure administration related question.
I already replied to this question about the timeline. But anyway, if he means that, I don't know, he is asking for some question and I didn't get the question, but usually within 3 working days, we are finalizing. We take the initial assessment. After that, we're asking for some testing, extra treatment. It depends, you know. But if he wants to follow up with one application or something, he can directly email us to our email. I can tell it now. It's montaji@dm.gov.a.
Mr. Surinder, I have a question for Engineer Hanan.
Mm-hmm.
Yeah. Engineer Hanan, you've been using this in your hospital for such a long time now. Are you looking at the wastewater, which is coming out of these tunnels? I agree with you that yes, you're using chemicals to disinfect, so it goes into the the normal sewage, or do you have a procedure of disposing this waste? Because God forbid it, but you could have some viruses and bacteria going in with the wash once after the misting. How are you controlling this hazardous waste disposal?
Actually, I have two type of tunnels. I have one tunnels in the hospital, which is located outside the door. So with this one, I'm not facing any problem. As all the liquid waste, it is evaporated before we are taking out or doing something. It's all evaporated, so it is not a challenge for me. The challenge for me in the field hospital. In the field hospital, the tunnel inside the cold area, inside the building, and we have to go inside this tunnel out. So here I have an accumulation of liquid. So we put one hose and we are getting it out in one tank. This is the solution. And then we are getting it with the municipal water. So we don't have a solution. It was a challenge for us because the engineer have to connect one hose and with a little pump to one tank, and we are collecting the liquid, then we have to throw it out. So this is the situation.
Okay, thank you very much. But I think once this wastewater is generated, once it touches the human body and, for example, takes in some bacteria or virus.
Infected with.
Yes. So don't you think we need to be disinfecting this water before it is disposed into the...
No, because it is already contain sodium hypochlorate and those things. Sometimes, we use the little of the concentrated from the gallon of the concentrated, and we are pouring on it, and that's it, because it will disinfect anyway.
All right. I think one more, Surinder, can I ask another question, or you want to ask one from the audience?
There is one from the audience. It's perhaps not directly related to disinfection tunnels. And I do believe this is addressed to Dr. Hessa. And it's from Ms. Tisha Alex. And she's saying, if we are using a UV robot for the disinfection of the workrooms, do we need to get any sort of approvals for the UV machine? I know that you have already spoken about UV, but in this context, would you like to answer?
It is outside our scope of approval, and I think if it's classified as medical device, because if they will, for sure, there will be like evidence they are killing some viruses, etc. Okay, from the industry, from the manufacturer. So I think it should be under the scope approval of Ministry of Health, but not sure. But let them check with them.
Not sure. It is under Ministry of Health.
I think
because we use such a machine, UV light, but it is not disinfectant, it is a sterilizer. So in the OT rooms and in the procedure treatment room, we use UV light. As Dr. Hassa mentioned, it is very dangerous. So the UV light, if have a sensor. So whenever you will open the door and it is still working, rotating around, it will stop automatically because it have a sensor, because it's very dangerous for the corona, the eyes and the skin. So it will stop working. And we are getting the approval from the MOHAP, Ministry of Health. And when the machine is coming also, it is tested from outside. It is safe even for the environment, safe for everything. He will bring it with the certificate and the ministry will approve it as well.
Okay, thank you so much. There's just one more question from the member of the audience. It's from a person called Dirk Krebentuch. I'm not sure if I'm pronouncing that right. And this question is perhaps addressed to Mani Nair, because you did speak on electrolyzed water, didn't you?
Yeah.
Yes. And so the question is, how is the heat or sunlight affecting the electrolyzed water agent for the sanitation tunnel use?
See, well, I mean, so far there is no any evidences where it has been adverse, in terms of other usage, or we haven't got any direct negative impact of using this particular superoxidized water diluted by 1:3 ratio. So with I mean, as the whole disinfection tunnels or the sanitization gate process has just started in the last 45 days or close to 2 months. So we would probably encounter something in the coming months or so on and so forth. We'll have to phase it. But then with all the chemical properties in the superoxidized solution, and with all the parameters, if one is using it based on the compliances, I think it's a safe product and it's a safe solution to be adapted.
Let me add something here, Mr. Surender. During summer, the consumption for whatever chemical you're using is going to go up, because the chlorine doesn't lock itself in normal water during summer. So, I mean, it's a general rule of thumb. You will see that consumption for any hotel or hospitality sector increases during the summer months, and then it starts petering down in winter. That's useful for you.
Okay, thank you. Chris, do you have any more questions? Because I'm done with the questions from members of the audience. Okay, now this could be for Engineer Hanan, Mr. Bjorn, or Mr. Mani. We are going to use spray, or you're going to mist or fog or fumigate, as Mr. Bjorn says. So we have got these spray heads, which have got these orifices in that. So Dr. Hessa, Dubai municipality has already got a rule for the Legionella pneumophila and other total bacterial count for anything that creates an aerosol. So in other words, this disinfection chamber also is going to do the same thing. It's going to create an aerosol and people are going to breathe it. Has Dubai municipality considered putting testing guidelines for these disinfection sprays, number one? And number two, from the engineering side, Mr. Bjorn, have you thought of getting these spray heads disinfected? Like, for example, in the hotels, now what happens is every 6 months, all the shower heads in the hotel are taken down and dismantled, and the biofilm scaling deposition is clean. So if Dr. Hessa can answer the first part of the question, and then we take the second part of the question to Mr. Bjorn.
In Dubai municipality, we don't have like a specific guideline for the testing of the water in chambers and tunnels, but we have a general guideline to test Legionella bacteria, because we know this is one of the concerns here in Dubai and in the Gulf. Okay, so yes, we have a program in testing Legionella bacteria, not from chamber only, I mean from the hotels, many buildings, swimming pools, and we check the water quality, etc. Yes, it is under our control, and we have an like inspection, regular inspection and auditing and sampling.
All right, thank you. So in other words, you might ask the end user to get these tests done.
Yes, and we can go directly, take sample and test it as well.
All right, thank you. Mr. Bjorn, you want to tell me about the disinfection of the spray heads within the chambers?
Well, it should disinfect itself, shouldn't it? If you are sending disinfectant through the pipe. That's number one. I think there will be another problem. You have to take it regularly down to clean the nozzles, because these nozzles will be very fine when you spray. They will be quickly closed down by calciums and other minerals that are in the water. So I don't have any experience how long time, but if you use any other nozzle that we know, within 3-4 weeks, we will have to open and clean the nozzles in order for them to perform according. Could I ask one question to the Mani here? Mani, you mentioned, because I am end user and I'm paying the bill. So you mentioned that when I talk about 30 pills per dosing. You said 10, and
Yeah.
I found out why. Because you are diluting it down to 1 to 3.
Yeah.
Are you sure that 1 to 3 is the correct mix for killing bacteria?
Well, this has
Has
been
there been any study on that? Because you cannot decide that if my shirt is wet, I can reduce the time. Okay, because it is about, because I can tell you that if you are not allowed to fog, misting per minute is 270 milliliter with that pressure of 350 psi, and spray is 600 milliliter because the holes in the nostrils is bigger, right?
Yeah, yeah.
So you cannot decide how much time and how much you spray. That has to be done by the lab.
Correct.
And that is the time it takes to pass through the tunnel.
Yeah.
And inside the cabinet that you were showing, you had a door and somebody standing inside. I don't think I would stay there very long. Okay. So we cannot leave this to the municipality, everything to decide. We have to, as end user, we have to do the right things. And that's why we are not investing in tunnel immediately. We want to understand what is the consequences.
Okay. So I let me answer that in terms of what has been our experience for the last 2 months. So the installations where we have done, so the client wanted a 5-second where they wanted the guest or whoever is passing through the tunnel not to get sprayed beyond 5 seconds. So when we recommended a 7 to 9 seconds of spraying, so it was purely a client's requirement that let us reduce the pressure, let us reduce the pressure so that obviously they would save in terms of their OPEX, but at the same time we did a test of keeping an object and running, because it's the nozzles are placed in there are 10 nozzles, so you will have right and left, where we kept 4 nozzles tilted to the body, so to the front of the body and the back of the body. And then there are 2 nozzles on the top wherein it faces again front and back. So with this, that's why we call it a 360. So you don't have to, there are some practices where when someone enters the tunnel, he or she does a spin, or probably some manufacturers say take a spin. But in our case, we have designed it that in a way where the spray is 360 degrees. So you are comfortably sanitized within that 5 to 7 seconds duration.
Mr. Surinder, if you don't have any questions, you want to sum up?
Yes, I think we are done with the questions, and I'd just like to say that first of all, thank you to the panelists and the presenter for what I believe has been a very useful session today, and I think we can all go back carrying that much more clarity from the discussions. And of course, Dubai municipality have very clearly said that the communication lines are open, so anyone that needs any further clarification on not only sanitation tunnels, but on anything to do in this epic fight against COVID-19, can reach out to the Dubai municipality for clarification. I have worked with the Public Health and Safety Department for several years as part of CPI Industry, and I have found the department always willing to listen and provide as much of clarity. So thank you, Dr. Hessa, for keeping up with that tradition and participating in this very useful discussion. Thank you so much. Beyond, thank you for giving what we believe is an end user perspective. You have expressed your concerns and reservations on why Lulu hypermarkets are still not considering these tunnels. Till I suppose all your questions are satisfactorily answered. So I appreciate your participation in this discussion. And Engineer Hanan, it's been a pleasure to receive a healthcare perspective on the tunnels, and we do appreciate your contribution to this webinar. And Mani, thank you so much for coming on board from a manufacturing and supplying perspective. It's been an all-round useful session, and thanks for answering the questions from the members of the audience. And with that, it's my pleasure to pass on the virtual microphone to my colleague Frederick Paye, who is the co-founder and commercial director of CPI Industry. Frederick, on to you.
Thank you very much, Surinder, and pleasure to see you all indeed, or at least some of you. Thank you very much for tuning in, all of those of you who dialed in from abroad. And I would like to thank all our distinguished panel of speakers for their outstanding contribution for this webinar. Very useful content indeed today, very much the need of the hour. And I would like to thank wholeheartedly Dubai Municipality. We've had a very long relationship and friendship with the governmental body, and we are very thankful for your contribution again today. Thank you very much for tuning in. Thank you also, Hanan, for your contribution. We realize that your agenda is, the fullest that it will ever be. And we thank you very much for your time today indeed. Bjorn, thank you very much also for your inputs, and Chris, as always, thank you for your inputs as well. I would like obviously proceed with the sponsor recognition kind of ceremony, if you allow me, please. Can you see the screen?
Yes, we can.
Right, okay. Fine, fantastic. So in our silver sponsor category, we have Miko. Unfortunately, they could not be among us today. As you may know, the flights have resumed in some of the European countries, so they had to unfortunately travel today. And we'll obviously thank our associate sponsor, Eurostar. Thank you very much, Mani, for your support and contribution. And also our strategic HVACR recruitment partner, carriersbay.com. Thank you very much to all our sponsors for making this webinar possible today. Now I would like to brief you and take you through the list of upcoming webinars that we have for you, in line for you. We've already conducted, this is our third one. And we have DC Dialogue on district cooling. This was supposed to happen earlier on in the year in Abu Dhabi, but obviously due to the COVID situation, we had to convert it online. So you're all more than welcome to attend this one, which will happen on the 22nd of June online. Then we shall carry on with our series of webinars on the air we breathe, on indoor air quality. It will be the third edition on the 24th of June. Leading on to the 29th of June, where we shall conduct a fire safety webinar entitled Towards a State of Calm, basically providing insights and recommendations on fire prevention and fire protection technologies. Very useful topic and always in demand. On the 9th of July, we shall be carrying out a webinar on business continuity and confidence building measures. So again, with a very good business content. On the 13th of July, Heart of the Matter, a webinar on pumping systems. Moving on in July, we shall be conducting the fourth edition of our very popular series entitled Refrigerants Review. So we welcome you. The theme will be Averting a Dangerous Warming Feedback Loop. On the 19th of July, we shall have one on smart HVAC systems. And as you may have read in the news already, we look forward to the government opening up again the MICE, that is the events, physical event sector, hopefully in September, obviously yet to be confirmed depending on the results. So we shall be hopefully seeing you in person this time in a hotel somewhere in Dubai with our client consultant contractor conference. It shall be the 4th edition. So we look forward to that. And concluding the year with our landmark event, which shall be the 10th Annual Climate Control Awards 2020 on the 24th of November, again in a hotel, hopefully in Dubai. The entries are free of cost. So any company having a project or a product that matches the criteria of the theme of the awards, which shall be unveiled very shortly, is entitled obviously to submit an entry and compete in a program. So please do check our website, climatecontrolawards.com, and please keep on checking also cprwebinars.com for the updated list of online events that we shall have. Again, I want to thank you all. I thank all of you for attending today and speaking and sponsoring that event. And from all of us at CPI Industry, look forward to seeing you in person, hopefully very, very shortly. Thank you very much.